Okay, let's unpack this. Imagine a pig, right? Growing incredibly fast, super efficient, but also needing everything, just so. What happens if the tiniest ingredients in its diet are missing? Today we're taking a deep dive into something maybe overlooked sometimes, but absolutely crucial: the world of vitamin and mineral nutrition in swine. We've got a fantastic stack of material here, really comprehensive analyses detailing the physiological roles, the alarming signs of deficiency, and yeah, the surprising economic ripple effects of these essential micronutrients. Our mission today is to give you a shortcut to truly understanding this complex, vital area.
Yeah, and what's fascinating here is how these seemingly small components, vitamins and minerals, how they regulate and facilitate this vast array of biochemical processes essential for life in a pig. They really are the precise tools that make all the complex machinery of life function smoothly. We'll cut through the complexity and highlight not just what these deficiencies look like, but maybe more importantly, why they matter. Why they matter to the health, the performance, and, the ultimate profitability of modern swine production.
So let's start with the basics then. You call these micronutrients regulators. What does that really mean in the day-to-day life of a pig? Why aren't, like, carbohydrates and proteins enough?
That's a great question. Because look, carbohydrates and proteins, they're like the fuel and the building blocks that provide the energy and the structure, right? But think of vitamins and minerals as the specialized wrenches, the tiny screws, the motor oil, maybe the spark plugs. Without those precise tools, even the best engine just won't run properly. Deficiencies can lead to, well, catastrophic failures, while excesses can be costly and sometimes even toxic.
Fascinating. Okay, so they're the ones making everything work. We can break these down a bit, maybe starting with the fat-soluble vitamins. Tell us about vitamins A, D, E, and K. What makes them unique in the body?
Right, so these are absorbed along with fats, and they can actually be stored, mainly in the liver. That storage offers a bit of a buffer, which is good, but it also means there's a toxicity risk if they're over-supplemented. Got to be careful. Take vitamin A or retinol. It's crucial for vision. It's a key part of rhodopsin. That's the light-sensing pigment in the eye, essential for seeing in low light. But beyond that, it's fundamental for maintaining the integrity of epithelial tissues. Think of that as the body's first line of defense, in the respiratory, digestive, reproductive, urinary systems. It's also indispensable for reproduction and tissue development. Now, here's a critical insight. Common feed ingredients like grains. They are remarkably poor, unreliable sources of vitamin A. Plus, maternal transfer to piglets is very limited, so those newborn piglets critically depend on the sow's colostrum and milk. It's a fundamental disconnect, really.
Wow, okay. Poor in-feed, limited transfer, relies on mom. Got it. What about D?
Vitamin D, cholecalciferol. It functions more like a hormone, actually. It's central to calcium and phosphorus regulation for bone mineralization and strength. And you mentioned modern confinement systems earlier. That's a key factor here.
Right, no sunlight.
Exactly. Pigs in confinement facilities have basically zero sunlight access, so they can't convert the inactive form in their skin into its active form. This makes dietary supplementation with vitamin D3 an absolute necessity. Otherwise, you get skeletal disorders.
Okay, mandatory supplementation there. And E, you mentioned it works with a mineral.
Yeah, vitamin E, alpha tocopherol. It's the body's primary fat-soluble antioxidant. Think of it as a cellular bodyguard protecting cell membranes from damage, especially in high metabolic tissues like muscle and immune cells. And yes, it works synergistically with the mineral selenium. We often talk about them together. Another important point, natural feed sources are unstable, and again, placental transfer is very limited. So newborn piglets, once again, rely almost entirely on sow's colostrum for their initial dose. It's interesting, too. Pigs from sows with grass pasture access have a significantly higher vitamin E status than those from confined sows. It highlights that natural connection again.
That makes sense. And K, blood clotting, right?
Precisely. Vitamin K is vital for blood coagulation, particularly for synthesizing clotting factors like prothrombin in the liver. Pigs get it from plants as K1, from their gut microflora as K2, though that can be variable and disrupted by antibiotics and synthetic forms like K3. Supplementation is pretty much standard practice just to be safe.
That gives us a great overview of the fat-soluble ones. You mentioned the storage factor. Does that make diagnosing deficiencies easier or maybe harder if the body can buffer for a while?
That's a good point. The storage can buffer, yeah, but it also means by the time you see clear signs, the deficiency might have been brewing for quite a while. It can mask the early stages.
Okay. And how do the water-soluble B complex vitamins differ fundamentally then?
Right. The big difference with the water-soluble B vitamins is they are not significantly stored. Not really. That means they have to be supplied pretty much continuously in the diet. Their main job. They primarily function as coenzymes in countless metabolic pathways. They form the backbone of cellular energy production. Think of them as the tiny gears that make all the big energy-producing reactions turn. Now, gut microflora can synthesize some B vitamins, but it's often insufficient in modern systems, especially like for pigs on slatted floors with limited access to feces.
Right, they can't get it from their environment as easily.
Exactly. So among these, you've got riboflavin, niacin, pantothenic acid, and biotin. These are metabolic coenzymes, all essential for carb, protein, and fat metabolism. Niacin is particularly challenging because a lot of it in grains is bound up and unavailable, so supplementation is almost always necessary.
Bound and unavailable.
Oh.
Okay, what about the others? B12.
Then you have vitamin B12 and folic acid. These are crucially linked to hematopoiesis, that's the fancy word for making blood cells, especially red blood cells carrying oxygen. And here's a really unique fact about B12. It is exclusively synthesized by microorganisms, completely absent in plant-based feeds.
Whoa, none at all in plants.
None. So this makes synthetic supplementation absolutely mandatory in typical corn soybean diets fed to pigs. You just have to add it. Folic acid, on the other hand, is vital for nucleic acid synthesis, DNA, RNA, particularly important during rapid tissue growth like, say, embryogenesis.
Okay. And you mentioned some specific ones for sows.
Yeah, we often talk about choline, pyridoxine, that's B6, folic acid, and biotin as reproduction-specific vitamins. They're often grouped into what are called SO-AD packs because they have such a direct impact on reproductive efficiency and longevity in the herd. Choline can improve conception and litter size. Pyridoxine improves litter size in the wean-estrus interval. Folic acid increases live-born piglets. And biotin is really well documented for hoof integrity.
Hoof integrity, how does that link to reproduction?
Well, poor hoof health leads to lameness. And lameness is a major reason sows get culled early from the breeding herd. So biotin indirectly influences sow longevity and productivity.
Ah, got it. Incredible how interconnected these systems are. Now let's shift gears to the minerals. We hear about macrominerals and microminerals. How do they differ, and what are their main jobs?
Right. So macrominerals are needed in larger quantities, usually expressed as a percentage of the diet. Their primary roles are structural components like bone, electrolyte balance, and nerve and muscle function. It's quite a lot, actually. About 5% of a pig's body weight is minerals.
5%. Okay, like calcium and phosphorus.
Exactly. Calcium, AA, and phosphorus P are the most abundant minerals, and they're inextricably linked. Their main role is structural, forming the strong matrix of bones and teeth. But they're also vital for muscle contraction, nerve impulses, blood clotting, and even energy compounds like ATP. And the CAC-D ratio, it's absolutely paramount. We'll probably come back to this, but too much calcium can literally interfere with phosphorus absorption, creating a functional deficiency.
Right, so the ratio is key. What about salt, sodium and chloride?
Sodium, Na, and chloride, Cl, are the principal extracellular electrolytes. They're essential for fluid balance and acid-base balance in the peri. They also help with nutrient absorption and protein digestion. Since grains are low in these, salt supplementation is universal, absolutely essential.
And potassium and magnesium.
Potassium K is the main intracellular cushion, important for nerve and muscle function. Magnesium Mg is a cofactor for, over 300 enzymatic reactions, including energy metabolism and protein synthesis, plus it has a structural role in bone. These are generally sufficient in most typical diets, although sometimes magnesium supplementation is used to try and improve sow fertility.
So those are the ones needed in larger amounts, the macros.
Yes.
And then the trace minerals, the microminerals, tiny amounts, but a huge impact, right?
Exactly. These are added in parts per million, ppm. So incredibly small quantities, but absolutely crucial.
Like iron, especially for piglets.
Oh, definitely iron, FAO. Critical for oxygen transport, hemoglobin in blood, myoglobin in muscle, and for energy metabolism. And here's where that unique challenge of modern confinement systems really hits hard again. Piglets are born with very limited iron stores. So's milk is notoriously poor in iron, and their growth is just explosively fast.
So a triple whammy.
Pretty much. That combination absolutely guarantees severe anemia within wints unless exogenous iron is provided, usually by injection. It is a non-negotiable management practice, a foundational piece of neonatal pig care, period.
Wow. Okay. What about zinc?
Zinc is a structural component or cofactor for countless enzymes. It's fundamental for the immune system and for skin integrity. It actually has a kind of dual role: nutritional, needed at low levels to prevent deficiency, and pharmacological.
Pharmacological.
Yeah, it's used at much higher levels, usually as zinc oxide, to help control post-weaning diarrhea in piglets. That pharmacological use, though, has some environmental concerns because of zinc accumulating in manure and then on land.
Right, okay. And copper, similar story.
Copper, Ko, is essential for iron metabolism, helping make hemoglobin plus connective tissues and cellular respiration. It also has a pharmacological role, often used as a growth promotant at levels like 125 to 250 ppm. It's considered to have an antibiotic-like effect at those levels. And like high zinc, this raises environmental concerns and also the potential for copper toxicity if fed for too long.
Got it. Manganese.
Manganese, Mn, is involved in bone formation, particularly the organic matrix part, and also in reproductive function.
Iodine. Right.
Yeah, iodine I has basically one known function. It's a required component of thyroid hormones, like thyroxine. These hormones regulate metabolic rate, growth, and development.
Okay. And selenium. You mentioned it works with vitamin E.
Yes, selenium say. It's a critical antioxidant mineral. Its primary role is in the enzyme glutathione peroxidase, or GPX, which protects cells from oxidative damage. Think of it like preventing rust at a microscopic level inside the cell. It works hand in glove with vitamin E, and it's also vital for immune function and reproductive health. Its use is actually carefully regulated by the FDA in the U.S., with a maximum of 0.3 ppm permitted in swine feed.
We've laid out all these critical roles, but if our hypothetical pig isn't getting enough of these vital nutrients, what happens? The sources mentioned diagnosing these can be tricky because many signs are nonspecific. So beyond just a pig looking, unthrifty, what should listeners specifically look out for?
That raises a really important question. How do we go from those vague signs like poor growth or a rough hair coat to a specific diagnosis? Because a deficiency often isn't just an isolated issue. It usually points to a broader problem in the nutritional program or maybe feed quality. We need to look for specific syndromes, those telltale, sometimes unique signs.
Okay, let's dive into some of the more maybe dramatic or recognizable clinical signs. What are the telltale signs for those fat-soluble vitamin deficiencies we started with?
Right. For vitamin A deficiency, you'd see things like failure to thrive, a rough hair coat, maybe incoordination, ataxia, difficulty walking properly. Ocular lesions are classic, night blindness progressing to xerophthalmia, which is dry eye, and potentially permanent blindness. You'd also see increased susceptibility to respiratory disorders because that epithelial tissue lining isn't holding up its defenses. And in sows, it can be truly catastrophic for reproduction. Irregular estrus cycles, weak, dead, or dramatically malformed piglets, things like blindness, born without eyes, cleft palate, or a really unique spinal cord herniation. Very specific, very severe.
Wow, devastating for reproduction. What about vitamin D or calcium phosphorus issues? You said they look similar.
Yeah, clinically, vitamin D deficiency is pretty much indistinguishable from calcium or phosphorus deficiency. In young, growing pigs, it leads to rickets. That's soft, flexible, often deformed long bones, stiffness, lameness, swollen joints. They just don't build bone correctly. In mature sows, you see osteomalacia or osteoporosis. That means brittle bones, spontaneous fractures, sometimes posterior paralysis, and the classic Downer sow syndrome.
The Downer sow, that's where they just can't get up.
Exactly. They're simply unable to stand, often due to vertebral fractures compressing the spinal cord. It's a truly debilitating condition, often seen late in lactation when calcium and phosphorus demands are highest.
Okay. And vitamin E, you mentioned sudden death. That sounds dramatic.
It is often acute and dramatic, yeah. Vitamin E deficiency frequently overlapping with selenium deficiency because they work together. The most dramatic manifestation is sudden death, and it typically hits the fastest growing, seemingly healthiest pigs in the group.
The best ones. Why them?
Probably because their metabolic rate is highest, generating more oxidative stress, making them more vulnerable when antioxidant defenses are low. On necropsy, the post-mortem exam, you see two main, quite striking presentations. One is mulberry heart disease, MHD. The heart is enlarged, with pale areas of necrosis, dead tissue, and dark areas of hemorrhage, giving it this mottled, bruised, kind of mulberry-like appearance. Often there's fluid accumulated around the heart, too. The other is hepatosis dietetica, HD. This involves massive liver necrosis. The liver is swollen, very fragile, easily broken with mottled hemorrhage and necrosis. It can even fatally rupture. You might also see white muscle disease, where skeletal muscles look pale with white streaks and definitely impaired reproduction.
Goodness. Mulberry heart, liver necrosis. Very specific signs there. And vitamin K bleeding issues.
Exactly. For vitamin K deficiency, the primary sign is prolonged blood clotting time. This leads to spontaneous hemorrhages, easy bruising, nosebleeds, internal bleeding. Even minor injuries, like bumping into something, can cause uncontrollable bleeding. Severe cases can result in sudden death from a massive internal hemorrhage. Interestingly, this can also be induced by certain mycotoxins sometimes found in feed, like decumerol, or ironically, by feeding excessive calcium, which can interfere with K absorption.
Wow, induced by other things too. Those fat-soluble signs sound incredibly severe, very visible. What about the water-soluble B vitamins? Are they equally dramatic or maybe more subtle?
They typically result in metabolic and neurological disturbances, and they tend to develop relatively quickly because there's no storage buffer, remember? So while some are dramatic, others can be a bit more insidious, maybe showing up as poor performance first.
Okay, like thiamine, B1.
With thiamine B1 deficiency, you'll often see poor appetite first, maybe a low body temperature, a slow heart rate. Neurological signs are common, potentially leading to something called polioencephalomalacia, or PM, which causes central nervous system issues like incoordination, tremors, and even sudden death from cardiac failure.
Riboflavin, you mentioned something specific in SOS.
Yeah, riboflavin B2 deficiency shows generally as poor growth, rough hair coat, diarrhea, maybe some skin lesions. But in SOS, it's quite specific and dramatic. Anorexia, severe reproductive failure, and often premature farrowing maybe 4 to 16 days early. And the piglets born are characteristic. Often hairless, underdeveloped, stillborn, and sometimes with enlarged forelegs. Very striking.
Hairless piglets, wow. Niacin, you mentioned pig pellagra.
Right, niacin deficiency is historically known as pig pellagra syndrome. It typically involves both dermatitis and enteritis. So you see diarrhea, vomiting, skin lesions, a rough hair coat, especially around the ears. Kind of a general sick pig look with specific skin and gut issues.
Okay, pantothenic acid.
Yeah.
The goose stepping.
Yes, that's the classic one for pantothenic acid deficiency. The most well-known characteristic neurological sign is a goose-stepping gait. It's an ataxia, stiffness, and this exaggerated high lifting of the hind feet when walking. It's quite distinctive once you see it.
I can picture that. Pyridoxine, B6. More neurosigns.
Primarily neurological for pyridoxine B6 deficiency, yes. It causes degeneration of sensory neurons, so you see ataxia, maybe a wide-based stance trying to keep balance, spasticity, and sometimes they sit in a peculiar dog-sitting position. Convulsions, seizures, and anemia are also possible.
Biotin. You mentioned hooves earlier.
Yes, biotin deficiency leads to really prominent dermatological and hoof issues. Hair loss, skin ulcerations, dermatitis, and critically transverse cracks in the hooves, sidewall cracks, and cracking or bleeding of the foot pads. As we said, this is a major contributor to lameness and therefore early culling in sows, significantly impacting herd longevity and economics.
Folic acid. Mostly reproductive.
Folic acid B9 deficiency can cause anemia and poor growth, but its primary impact that we focus on is in sow reproduction. It leads to reduced litter size and fewer live-born piglets because of its crucial role in embryonic survival early in gestation.
B12. Anemia again.
The hallmark sign of vitamin B12 deficiency is indeed anemia. Other general signs include poor growth and reproductive failure. In really young neonatal pigs, you might see hyperirritability, maybe voice failure, they can't squeal properly, and pain or incoordination in their hindquarters.
And choline. Spraddle-legged piglets.
Yeah, for choline, you can see neurological signs like incoordination, sometimes an abnormal shoulder conformation. But in sows, a deficiency is most strongly associated with reduced litter size and an increased incidence of spraddle-legged piglets. Those are piglets born unable to bring their legs underneath them, making it hard for them to stand or nurse. Difficult to manage.
The specific details you're giving for each deficiency really make these stick.
Yeah.
Now let's quickly cover the minerals again, but the deficiency signs. Calcium and phosphorus and salt, these seem so fundamental.
They are. And calcium and phosphorus deficiencies, as we said, are clinically identical and unfortunately quite common in swine if diets aren't balanced correctly. In young pigs, it manifests as rickets, lameness, bone deformities, fractures, poor growth, just weak skeletons. In sows, it leads to osteoporosis or osteomalacia, brittle bones, fractures, and that debilitating Downer sow syndrome, especially in late lactation.
Okay. And salt. Sodium and chloride.
For sodium and chloride, or just salt deficiency, the immediate effect is reduced feed and water intake. Pigs just won't eat or drink as much, leading quickly to poor growth. Conversely, you have to watch out for salt toxicity or salt poisoning. This happens with high dietary salt combined with restricted water access. Maybe a water line gets blocked.
Water restriction is key there.
Absolutely. That combination leads to severe neurological signs. Nervousness, staggering, seizures, paralysis, and potentially death. It's an emergency situation.
Got it. And what about the trace minerals, the ones needed in such tiny quantities? Iron.
For iron, it's the most common deficiency, hands down, in neonatal piglets in modern confinement systems. Iron deficiency anemia develops really fast, within 1–2 weeks. The piglets look pale, they're listless, have poor growth. The classic sign is thumps, that's labored, spasmodic breathing, kind of a jerky abdominal breathing pattern because their heart has enlarged, trying to compensate for the lack of oxygen carrying capacity. It also severely compromises their immune system, leaving them wide open to other infections.
Thumps. Okay, that's memorable. Zinc. The skin condition.
Yes, zinc deficiency results in a very distinct skin condition called parakeratosis. It's a rough, scaly, cracked skin, typically symmetrical, often seen on the belly, legs, and face. The skin can become really thickened and crusty. Importantly, this is often made worse or even triggered by excessive dietary calcium interfering with zinc absorption.
Another interaction there.
Exactly. Other signs include poor growth and impaired sexual development. Copper deficiency causes anemia, but it's secondary to impaired iron utilization. Copper is needed to move iron around. Also, reduced growth, incoordination, defective bone formation, and cardiac enlargement.
Iodine. The goiter.
Yep. Iodine deficiency primarily impacts the thyroid gland and fetal development. The classic sign is goiter, which is simply an enlarged thyroid gland in the neck. But the more devastating signs are in the offspring of deficient sows, weak or dead piglets that are characteristically hairless, often with thick, pulpy, swollen skin. Stillbirths and prolonged gestation are also common.
Hairless piglets again. Okay. Manganese.
Manganese deficiency leads to impaired growth, lameness, and skeletal deformities like enlarged hocks and crooked legs. It also causes reproductive problems in the breeding herd, poor conception rates, maybe smaller litters.
And finally, selenium. You said it mirrors vitamin E.
Pretty much. The clinical signs of selenium deficiency are virtually identical to those of vitamin E deficiency because they work together so closely in antioxidant defense. So again, you see sudden death from mulberry heart disease, MHD, white muscle disease, liver necrosis, hepatosis dietetica, HD, and impaired reproduction. You might also see edema, which is fluid accumulation in various tissues. It's often hard to tell E and SAE apart just based on clinical signs alone.
Okay, that's a lot of potential problems. It really sounds like a complex puzzle to solve when a deficiency hits. So how do we accurately diagnose these issues, figure out which one it is, and maybe more importantly, how do we prevent them from happening in the first place?
Right. This is where we need to move from being reactive, just treating sick animals, to being proactive with management and nutrition. A definitive diagnosis really needs a systematic investigation. You can't just rely on seeing 1 or 2 clinical signs because, as we've seen, many are nonspecific or overlap.
Okay, walk us through that diagnostic process. If a producer sees some of these signs cropping up in their herd, what's the first step? Where do they start?
It really involves a 3-step approach, ideally. First is gathering the clinical history and doing an environmental assessment. This means getting detailed information on the herd demographics, which ages are affected, what percentage, what are the specific clinical signs being observed, and critically reviewing management practices. What's the exact feed composition? What about water access and quality, housing conditions? Any recent stressors like moving pigs or disease outbreaks? Performance records, feed intake, growth rates, conception rates are also vital clues.
So gathering all the background info first. Then what?
Second is the physical examination and necropsy. You need to actually examine live affected pigs, looking carefully for the specific signs we discussed, the gait, the skin, the breathing. But necropsy, doing a post-mortem examination on recently deceased or maybe humanely euthanized animals, is incredibly powerful. It lets you look inside. You're specifically looking for those characteristic lesions, damage to the heart or liver that suggests vitamin selenium deficiency, problems with the bones indicating calcium, phosphorus, vitamin D issues, those skin changes for zinc, or maybe an enlarged thyroid pointing towards iodine deficiency.
Okay, the postmortem gives you big clues. What's the final confirmation?
Third is laboratory analysis. This is often what confirms the suspected deficiency. This includes analyzing the feed and water. This is critical for identifying formulation errors, nutrient shortfalls, or maybe the presence of antagonists like mycotoxins that could be interfering. Proper sampling technique and storage of those samples is crucial here. It's often overlooked but vital for getting accurate results.
Right, garbage in, garbage out with lab tests.
Exactly. Then you'll likely do blood analysis. This gives you a real-time snapshot of the nutrient status in the affected animals. Serum is usually used for checking levels of vitamin A, E, D, calcium, and phosphorus. Whole blood is used for a complete blood count, or CBC, to definitively diagnose anemia. You're looking for hemoglobin levels typically below 9 grams per deciliter to confirm iron deficiency anemia in piglets. And finally, tissue analysis can be useful for assessing longer-term stores of certain nutrients. The liver is excellent for checking vitamin A, E, selenium, and copper status. Bone analysis, specifically getting the defatted bone ash percentage, is considered the gold standard for assessing the overall skeletal mineralization status, reflecting Ca, P, and Vit-D adequacy over time.
Okay, so history, examinocropsy, and lab tests. Once it's diagnosed, how do you treat the acutely affected animals? You can't just wait for a new batch of feed to cycle through, right? Especially if they're really sick.
Exactly. Time is often critical. The route of administration really matters here. Injectable therapy is usually the best bet for acutely ill or anorexic animals, pigs that aren't eating. Why? Because it provides a rapid, precise, highly bioavailable dose directly into the bloodstream or muscle, bypassing any gut absorption issues. It's the standard, non-negotiable method for treating neonatal iron deficiency, that 100 to 200 milligram iron dextrin injection given in the neck muscle within the first few days of life. It's also highly effective for treating acute vitamin E or selenium deficiency. An injection can often bring about a swift improvement in affected animals.
Okay, injections for emergencies. What about treating the whole group or less severe cases?
Right. Oral or in-feed therapy is more suitable for treating larger groups or maybe managing some clinical issues where pigs are still eating. The main drawback, though, is that sick animals, especially those with reduced appetite, may not eat enough feed to get an adequate therapeutic dose, so it's not always reliable for severe, acute cases. For something like zinc parakeratosis, the treatment is primarily dietary correction. You need to remove any excessive calcium in the diet that might be interfering and ensure adequate supplemental zinc is provided in the feed.
Makes sense. But really, prevention is always better and probably more economical in the long run, right?
Yeah.
What are the cornerstones of prophylactic nutrition? How do we get ahead of these issues?
Absolutely. Prevention is by far the most effective and economical approach. You want to avoid getting into these deficiency situations in the first place. This really comes down to two main things: precise diet formulation based on known requirements, and using high-quality supplements consistently.
Okay, talk about supplements. Premixes are common, right?
Yes, the role of premixes is absolutely central. Vitamin and trace mineral, or VTM, premixes are essential for achieving uniform distribution of these tiny quantities of nutrients throughout large batches of feed. You can't just sprinkle them on top. Now, here's a crucial detail, and actually a common mistake producers or feed mills might make: combining certain vitamins and minerals in the same premix. It's generally recommended to use separate vitamin and mineral premixes. Why? Because certain trace minerals, especially things like copper and iron, can actually degrade some of the more sensitive vitamins like A, D, and E during storage, especially if the premix sits around for a while or gets exposed to heat or moisture.
So they can destroy each other in the bag.
They can, reducing the potency. If a combined VTM premix is used, its age and storage conditions must be very carefully monitored to ensure the vitamins are still active when the feed is mixed. Separate premixes avoid that risk.
Good tip. What else for prevention?
Then there's meeting requirements across life stages. A pig's nutritional needs change dramatically throughout its life. A tiny piglet has very different needs than a huge finishing hog or a pregnant sow. So phase feeding for growing and finishing pigs is standard practice now. It allows you to tailor the nutrient supply more closely to their requirements as they grow, which avoids costly oversupplementation early on and ensures adequacy later. It improves efficiency. And breeding herd nutrition is vastly different again. Gestating sows are typically limit-fed to control weight gain, so their diets need to be highly fortified with vitamins and minerals to ensure they get enough in a smaller amount of feed. Lactating sows, on the other hand, have enormous nutrient demands for milk production. They need very dense diets, high in energy, protein, and micronutrients to support milk yield and avoid depleting their own body reserves, which could hurt future reproduction.
Tailoring the diet to the specific pig. Makes sense. And you mentioned bioavailability, making sure they can actually use the nutrients.
Exactly. That's the third key area: enhancing bioavailability. It's not just about how much of a nutrient is in the feed, but how much the pig can actually absorb and utilize. The biggest player here is phytase. Adding the enzyme phytase to swine diets is now almost universal standard practice, certainly in corn-soy-based diets.
How does phytase work?
Phytate is a compound found in plants, especially grains and oilseeds, that binds up a significant portion of the phosphorus, making it unavailable to the pig. Phytate also binds other minerals like calcium, zinc, and iron to some extent. Phytase is an enzyme that breaks down this phytate molecule in the pig's gut, releasing the bound phosphorus and other minerals, making them available for absorption.
So it unlocks nutrients already in the feed.
Precisely. It dramatically improves phosphorus digestibility, which means you can feed less supplemental inorganic phosphorus, saving costs, and very importantly, significantly reducing phosphorus excretion in the manure, which is a major environmental benefit. It's a real game changer in modern swine nutrition.
Wow, that's huge. Any other ways to boost bioavailability?
Yes, another area is the use of organic minerals. These are trace minerals like zinc, copper, manganese, iron, selenium that are chelated or bound to organic molecules like amino acids or small peptides. The idea is that these organic forms are sometimes absorbed more efficiently by the pig or are less prone to negative interactions in the gut compared to traditional inorganic forms like sulfates or oxides. For selenium, for example, organic sources like selenium-enriched yeast generally show superior absorption and tissue deposition compared to inorganic sodium selenite. There's ongoing research, but organic minerals are increasingly used, especially in critical phases like breeding or nursery diets.
Okay, phytase and organic minerals, boosting what the pig actually gets. That leads us back perfectly to something you flagged earlier, the calcium to phosphorus ratio. You called it paramount. Why is it so critically important, and what happens if it's off?
Right. This is probably the most critical mineral interaction to get right in swine diets, and it's often misunderstood or mismanaged, sometimes with costly consequences. The critical insight here is that more calcium isn't always better. In fact, feeding too much dietary calcium directly antagonizes phosphorus absorption.
How does it do that?
It forms insoluble calcium phosphate complexes in the gut, basically locking up the phosphorus so the pig can't absorb it. This means feeding excessive calcium, even if the total phosphorus level in the diet seems adequate on paper, can create a functional phosphorus deficiency. The pig just can't get to the phosphorus.
Well, that leads to
Those skeletal problems we talked about: rickets, osteomalacia, poor growth, fractures, and overall poor performance.
So getting the ratio right is crucial. What should it be?
For formulation targets, diets must be formulated to achieve a specific ratio. Historically, people talked about the total KP ratio, aiming for maybe 1.1 to 1.25.1. But now, with more precision, especially with phytase use, nutritionists focus on the digestible or available KP ratio. The target varies by age, but for example, maybe 1.2.1 to 1.40.1 digestible KP to digestible P for nursery pigs. It requires careful calculation.
And you mentioned a risk with cheap calcium.
Yes, this is a significant practical challenge. Ground limestone, the main source of calcium, is very inexpensive compared to phosphorus sources. So when using least-cost formulation software to make diets cheaper, there is a temptation to let the calcium level float up high because it's cheap, without putting strict constraints on the KP ratio.
The computer might make a cheap diet that's actually bad for the pigs.
Exactly. It's a dangerous and unfortunately common, costly error. It can lead to diets with excessively wide KP ratios that severely impair phosphorus utilization and overall performance. Nutritionists must set appropriate maximum calcium constraints, or better yet, formulate diets strictly based on the digestible or available KP ratio to avoid this trap. It's one of those hidden nutritional landmines that can really hurt profitability.
That makes perfect sense. Okay, so it's crystal clear these micronutrients are vital for animal health and performance.
Yeah.
But let's talk bottom line. How do these nutritional decisions translate into actual dollars and cents for producers? What's the real economic impact beyond just, a sick pig here or there?
Right. If we connect this to the bigger picture, feed costs are typically the largest single expense in swine production, often up to 70 or 75% of total costs. So nutrition is absolutely central to profitability. And micronutrient deficiencies, even subtle ones, can significantly erode that profitability in multiple ways.
Okay, let's start with the obvious ones, clinical deficiencies, the ones we can clearly see. How do you quantify those costs?
Clinical deficiencies mean direct, easily quantifiable losses. First, there's animal mortality, the actual lost value of a pig that dies from something like mulberry heart disease or severe anemia. Then you have the direct costs of dealing with the problem: veterinary fees, diagnostic lab costs, the cost of medications or injectable treatments. Sometimes even carcass condemnations at the processing plant if lesions are found. Beyond that, there are the production losses in the surviving animals. Stunted growth means pigs take longer to reach market weight, which increases fixed costs like labor, utilities, and facility use per pig. And a poor feed conversion ratio, FCR, meaning it takes more pounds of feed to produce a pound of pork, directly increases the total feed cost, which is usually the biggest cost driver. It's fairly easy to add up those direct, obvious losses from a clinical outbreak.
Okay, those are the visible costs.
Yeah.
But you mentioned earlier that subclinical deficiencies might actually be the greater economic threat. That sounds kind of insidious, like something that could really creep up on a producer without them realizing it.
This raises a really important question, doesn't it? What you can't easily see can often hurt your bottom line more in the long run. Subclinical deficiencies, by definition, don't show those overt dramatic disease signs. You don't necessarily have pigs dropping dead or showing classic goose stepping, but they create this persistent, low-level drag on overall herd performance and efficiency.
Like what specifically? How would that work?
Well, for example, subclinical iron deficiency in piglets might not cause full-blown thumps, but it could mean they have slightly lower weaning weights, maybe reduced growth rates right after weaning, and maybe a chronically compromised immune system. That compromised immunity makes them more susceptible to other common costly diseases later on, like respiratory infections or scours. So the iron issue isn't the direct cause of that sickness, but it paved the way.
It makes them weaker.
Exactly. Or think about breeding sows. A marginal subclinical deficiency of a key reproductive vitamin like folic acid or biotin might not cause obvious reproductive failure, but maybe it results in just half a pig less per litter weaned on average across the herd.
Half a pig. Doesn't sound like much.
Doesn't sound like much for one sow, maybe. But multiply that half pig loss by hundreds or thousands of sows in a modern operation over the course of a year. That becomes a truly significant financial loss in terms of fewer pigs to sell. Economic modeling tools like calculating income over feed cost, IOFC, really highlight this. They show how even small improvements in feed efficiency, say just 5%, can provide a significant financial advantage, even if achieving that requires using a slightly more expensive, better fortified diet. It's those small, persistent inefficiencies caused by subclinical issues that accumulate into substantial financial losses over time, often unnoticed until the producer looks closely at their financial records and wonders why margins are tighter than expected.
So getting the nutrition right, especially preventing those subclinical drags, becomes not just about animal health, but actually a high-return investment strategy for the farm.
Precisely. That's the key takeaway. The marginal cost of using a high-quality vitamin and mineral premix, or adding an effective dose of phytis, or maybe using a good mycotoxin binder if needed, is usually minimal in the grand scheme of the total feed cost, maybe pennies per pig. But preventing even a small, say 5 to 10%, reduction in feed efficiency, or avoiding one costly disease outbreak that subclinical deficiencies might predispose animals to, can easily save tens of dollars per pig in reduced feed costs and maintained revenue from healthy, growing animals. The return on investment, ROI, for proactive prophylactic nutrition, getting those micronutrients right, is almost invariably very high. It's about spending smarter on prevention rather than spending more later on treatment and lost performance.
That makes a lot of sense. And there's even a trade-off sometimes with manure value. That's a unique angle I hadn't considered.
Yeah, it's an interesting point, especially for integrated crop livestock systems where the manure is valued as fertilizer for crops grown on the same farm. Some strategies used to lower feed costs or improve nutrient utilization in the pig, for instance, using synthetic amino acids to reduce total protein, or using high levels of phytase to reduce supplemental phosphorus can, by definition, reduce the concentration of those nutrients, like nitrogen and phosphorus, in the manure.
So better feed efficiency might mean less valuable fertilizer.
Potentially, yes. It lowers the fertilizer value per ton of manure. So producers in those integrated systems might need to do a whole farm financial analysis. They need to compare the savings they achieve in feed costs against any potential loss in manure fertilizer value, or the need to purchase more commercial fertilizer for their crops. It's about looking at the economics of the entire system, not just the pig enterprise in isolation.
Fascinating. Okay, brings it all together.
So if we really connect this all to the bigger picture, mastering vitamin and mineral nutrition isn't just, one small component of swine production. It's really a central driver of its success, its efficiency, and ultimately its sustainability.
Yeah, absolutely. We've seen today how modern high-efficiency farming itself inherently creates some of these nutritional gaps, making precise supplementation pretty much non-negotiable. We also learned that diagnosis isn't just about looking at sick pigs, but requires this multi-tool, systematic investigation history, necropsy, lab work, and perhaps the most profound insight for many might be that the silent, subclinical deficiencies, the ones you don't easily see, are often the biggest economic threat, that constant drag on profitability.
Our deep dive today really underscores that knowledge, especially complex nutritional knowledge, is most valuable when it's truly understood and then consistently applied in practice. It's about recognizing that every nutritional decision, even for the smallest micronutrient added in parts per million, can have these profound ripple effects throughout the entire system, impacting everything from the individual pig's health and welfare right through to the producer's bottom line and environmental footprint.
So, what does this all mean for you listening in? Well, it means that understanding the complex interplay of these tiny elements reveals the incredible ingenuity and precision that's required to feed a growing world efficiently and responsibly. It really highlights how science, constant vigilance, and a proactive mindset aren't just buzzwords in agriculture, but absolutely essential tools for achieving success in these complex biological and economic systems. And for your final provocative thought today, consider how many other complex systems in our world, maybe in business or technology or even societal structures, might be silently undermined by their own kind of subclinical deficiencies. Small, unseen imbalances or overlooked details that, when aggregated across the whole system, lead to massive hidden costs or inefficiencies. What might we be missing in other areas of our lives or work by not looking closely enough at the small stuff?